Hi everybody, welcome to today's edition of TPI Talk. I'm Carter Singleton and I'm sitting down today with Dr. Hunter Boggs, who is a radiation oncologist at the UAB Medicine Russell Medical Cancer Center here in Alexander City. Thanks for coming, Dr. Boggs.
Thanks for having me.
We really appreciate you taking time out of your busy day when you're here in Alexander City to come sit down and talk to us.
Sure, happy to.
So, to kick things off, why don't you tell us a little bit about yourself, where you're from, where you were raised, and your medical training?
Yeah, sure. So I was born and raised in rural northeast Louisiana, so very used to and have a place near to my heart to small towns, specifically bringing care to folks that live in small towns. So I trained at LSU Shreveport, did 5 years of radiation oncology residency up at University of Maryland in Baltimore. And then wanted to get a little bit closer to home, wanted to get back south to be near family and work in an academic center. So landed UAB about 3 years ago. Been happy here.
Well, hey, we're really glad to have you here, and Alabama is thankful to have doctors like you pick us to be here. Why don't you tell us a little bit about why you wanted to become a doctor and what your interest in radiation oncology is?
I've known I wanted to be a doctor since I was a kid. I went back and saw some pictures of me drawing myself as a doctor. My grandfather was a doctor. He was a surgeon, and his brother, and they really inspired me. I was drawn to the field of oncology or cancer care about first year medical school. Really had a chance to sit down and to listen to how the physicians could interact with the patients and really establish that relationship. And at a time when they're really nervous and have a loss of control and really don't know what to do next, you can offer that guidance with them.
Yeah, so bedside manner is obviously very important in oncology, just because that can be a rough time on not only the patients but their families, and having a doctor there that can be friendly and coach you through the process. I can see where that would that make a big difference in the care that you're able to give a patient. You practice radiation oncology. Can you tell us a little bit about what the differences are in medical oncology and radiation oncology?
Sure. So radiation oncology uses high doses of very targeted radiation therapy to treat different cancer sites. So unlike medical oncology, which treats the entire body, radiation oncology is specifically focused at treating certain parts of the body. So our goal is to treat and to kill the tumor, or to treat and to kill tumor cells in a tumor bed while minimizing or decreasing the dose to normal tissue. And that's kind of what we do, so much more local treatment. We get to really kind of establish care, long-term care with cancer patients, because they're coming in for radiation every day for 6 weeks, 4, 5, 6 weeks, and then we continue to follow up with them thereafter. So a lot of patient interaction. We get to use the technology, that's available to us to kind of improve that care for patients.
Interesting, very interesting. I know my great uncle is a brain cancer survivor, and he's been cured. His cancer's been in remission for about 7 years, and they actually used radiation oncology to shrink the tumor in his brain. It was actually effective. So direct family association with your type of cancer care. You have recently begun treating left-sided breast cancer patients here in the center with respiratory gating therapy. Can you tell us a little bit about that and why it's important?
Yeah, absolutely. So like I talked about before, one of the most important things in radiation oncology is to hit the tumor while avoiding dose to the normal tissues. When we treat patients with left-sided breast cancer, the heart is right behind the chest wall area. And so sometimes it's very hard to avoid treating directly through the heart. We know that the more dose we give to the heart, the higher the chances of radiation-induced heart problems 15, 20 years down the road, such as heart attacks, coronary artery disease. A technique that has been around for a long time at UAB, up where I practice a few days a week, and we've just gotten here about a month ago, is what's called deep inspiration breath hold or respiratory gating technology. So simply what this is your breast is here, your heart is here. We scan you in a normal breathing pattern, and then we have you take a deep breath in, and when that happens, you expand your lung, your heart pulls down and away from the radiation field. And so we can capture that, and we can tell kind of right then whether a patient would benefit from this or not. Most patients do. And then what happens is this device that is on them will measure that they're taking an appropriate breath. And so every time they take this breath in, that's when we treat. And so we're able to really decrease dose to the heart. Before we were having to send patients up to Birmingham that needed this. I mean, I believe so strongly in it that, I was having to talk people into uprooting from their home and from their lives for 4, 5, 6 weeks to go up to UAB and get this treatment. And I'm very happy to have this here now to be able to keep patients at home.
Absolutely, absolutely. There's no place like home when you're going through a rough time or going through something as emotional that takes a toll on you and your family, like going through cancer treatment. Mm-hmm. So it's almost a pulse that the radiation pulses. The radiation
is not necessarily a pulse. It's the machine on you will capture when you're breathing in an appropriate amount, and that turns the machine on. Does that make sense? And
yes.
So you take a deep breath in, and then the machine says, okay, your breath is good enough, start treating. Okay, you start treating while the breath is held, and then as soon as the patient starts to breathe again, we can see that, and we stop treating and let them catch their breath, and then they take a deep breath in and hold it for as long as they're comfortable. So we're only treating when the breath is held. So every time the breath is held, their heart is pulled away from the radiation field.
So it would be, you get the patients to breathe in and hold and treat and then release.
Got
okay.
Got
yes.
It. Yep.
Awesome. Thank you. Sometimes I just take a little bit longer to kind of understand, and
sure.
I just think that this is really interesting, and it has a big impact. I would say, especially for women in the area that might have breast cancer and need to stay here to have breast cancer treated. I mean, it's an awesome resource, and as much information as I can learn about it today, I'd love to. What do you want the public to know about the Cancer Center? What are some things you could share?
Yeah, sure. So the Cancer Center at Russell Medical Center is a joint venture, which is basically a 50-50 ownership of this Cancer Center by UAB and by Russell. Okay, so it's a true partnership, kind of from the ground up, between the two centers, and so we work extremely closely with the Russell physicians, and we're able to really integrate in the quality of care from the radiation perspective that we have at UAB with the Russell Medical Center facilities. So my goal has been, since I've gotten down here, that a patient who has cancer can know right away whether they can stay at home, and if they can stay at home to get treatment, that their quality of care is exactly the same as if they were going up to UAB. And we've worked really hard on establishing guidelines for up at UAB, and then bringing these guidelines down here to Russell Medical Center, so it's the exact same standard of care. So I think that's the thing I really want people to know, is that when you're coming down here to get radiation treatment, you are getting the exact same quality of care as if you were up in Birmingham at the Hazelrigg-Salter building getting radiation treatment. I think one more thing I wanted to talk about that's interesting, and again near and dear to me, is breast cancer. So about a year ago, we started having 3 of our breast surgeons coming down and seeing patients and doing surgeries down here. I work extremely closely with them. We have what's called a multidisciplinary breast clinic up at UAB that's been award-winning. So we've tried to bring that model down here. And so, if the surgeon sees a patient, they want us to see the patient immediately. They'll pick up the phone and call us. We discuss the imaging, and we come up with a plan and actually see the patient before they ever go to surgery. So the patient knows what all their options are, what radiation's like, whether they'll need chemo, what chemotherapy is like, so they can make the best decision for them. And again, our goal is to, as best as we can, keep the patients here and give the exact same quality of care as if people that have to travel kind of from all the way around the state to go up to Birmingham.
Well, I think that's a fantastic resource that we just have right here in our backyard in Alexander City, right here in our community. And I think it's fantastic that you're down here working so hard to make sure that cancer patients within our community are able to stay at home and be close to their families. So thank you as someone that lives here. It's greatly appreciated. But Dr. Boggs took a lot of time out of his very long day down here helping treat patients and spend time with patients to be here with us. And I'd like to thank you guys for tuning in. Thank you, Dr. Boggs, for coming and sitting down with us. And I hope you enjoyed this episode of TPI Talk. I'm Carter Singleton, and I'll see you next time.